Good morning, everyone, and welcome to the webinar, LGBTQ Cessation, the Power of Collaboration. We have a lot of folks still logging on right now, so we're just going to give it a few more moments, and then we will get started. So please get comfortable, grab your coffee, your pastry, and yeah, we'll start in just about maybe 30 more seconds.
Buenos días a todos, bienvenidos a la Cessation LGBTQ, el poder de la colaboración. Las personas ahorita todavía se están acomodando, entonces siéntanse libre a agarrar su cafecito y todo y vamos a empezar en unos cuantos minutos. Gracias.
Great. It looks like it's slowed down in letting everybody in. So I think we have a really good start of folks who are joining us. Thank you again. My name is Danny Cessation. I am the LGBTQ program manager for We Breathe, and my pronouns are he and they. Before we actually get started, I would like to turn it over to our Spanish translators, Gloria, on how to access Spanish translation.
Gloria, I think you're muted.
Thank you, gracias. Bueno, hola, ahora solamente para resumir lo que ha dicho Daniel, parece que ya tenemos todas las personas que vamos a tener, entonces vamos a empezar. Yo me llamo Daniel, uso los pronombres él y ella y ahora se lo vamos a pasar a nuestros intérpretes para que nos den unas instrucciones de cómo acceder a la interpretación. Hola a todos, mi nombre es Gloria, uso pronombres ella y estoy aquí con mi co-intérprete José Eduardo, que también usa pronombres ella. Y hoy el día vamos a estar interpretando del inglés al español y el español al inglés. Hello everyone, my name is Gloria and I use they, them pronouns, and I'm also here with my co-interpreter José Eduardo, who uses they, them pronouns as well. Today we're going to be interpreting this event from Spanish to English and English to Spanish. Entonces, como verán, vamos a estar usando la función de interpretación que proporciona Zoom. El anfitrión ya ha aprendido esta función de interpretación y pueden verlo. So as you'll see, we are going to be using the Zoom interpretation function for this meeting. The host has already activated this function, as you can see at the bottom of your screen. Para ustedes que están usando sus computadoras, podrán ver un globo terráqueo en la parte inferior de su pantalla con la palabra interpretación. Hagan clic ahí y después pueden elegir inglés o español. For those of you using computers, you'll see a globe icon at the bottom of your screen with the word interpretation. Click on that and then you can see that you can choose English or Spanish. Si se están sumando a través de su teléfono inteligente, aplicación o tableta, pueden buscar los 3 puntitos donde dicen más. Va a haber una lista y por favor hagan clic en la interpretación de idiomas y pueden elegir inglés o en español. Por favor, recuerden de hacer clic en finalizar. If you are joining today through a smartphone app or tablet, look for the 3 dots that say more. Click on language interpretation and then choose English or Spanish, and then remember to click done. Para las personas que entienden el inglés y el español, no tienen que elegir un canal de idioma y pueden participar en el lenguaje que más les guste, pero sí les vamos a pedir a las personas que no son bilingües en ambos idiomas que por favor elijan un idioma. For those folks who understand both English and Spanish, you don't have to choose a language and you can participate in whatever language, but we will ask that for those of you who are not bilingual in both of these languages to please choose a channel to participate. Entonces vamos a hacer una prueba ahorita. Ahorita estoy hablando en español y quiero ver si las personas pueden escuchar la interpretación al inglés en el canal de inglés. Y si pueden escucharlo, por favor, háganme una señal con sus dedos o en el chat diciéndome que pueden escuchar a mi cointérprete en el canal de inglés. Todavía no veo una señal. Perfecto, veo que sí. All right, so we're going to do a little test. And so now I'm speaking in English, and you should be able to hear my co-interpreter in the Spanish channel. So if you could just give me a sign that you can hear them. Perfect. Can you hear the Spanish interpretation? You got the English, but can somebody let me know? Perfect, perfect, perfect. Gracias, Gerardo. Thank you, Gerardo. Bien, ahora les vamos a compartir algunas pautas para el día de hoy. Recuerden que se requiere un compromiso para todas las personas en este espacio para poder crear este espacio multilingüe. Les vamos a recordar que por favor hablen a un paso moderado para que podamos captar todo el mensaje y también transmitirlo en el otro idioma. Les vamos a pedir que por favor hablen claro y que verifiquen que su micrófono esté funcionando y por favor minimicen cualquier ruido en el fondo que tengan. También les vamos a pedir que por favor tomen unas pausas largas después de hacer una pregunta, porque las personas que están escuchando la interpretación va a haber un retraso en el mensaje, entonces queremos asegurarnos que puedan escuchar la pregunta antes de tener la oportunidad de responder. Y también les vamos a recordar que tomen también una pausa o un respiro después de cada oración o pregunta y cuando estén cambiando de ponentes. La recomendación es que cuenten hasta 3. 1, 2, 3 después de cada pregunta y después de cada oración. Por las mismas razones, para asegurar que la persona reciba toda la interpretación y nosotros, los intérpretes, no tenemos que estar a la carrera tratando de interpretar todo. También les vamos a pedir que por favor tengan su micrófono en silencio si no están hablando y que por favor hablen en el canal, hablen con el idioma que corresponda con el canal de idioma en que están. Para cualquier número o estadística, les vamos a pedir por favor que repitan esos números y declárenlos claramente para que podamos captar esa estadística o ese número. Y también para cualquier abreviación que tengan, por favor usen todo el término y por la primera vez y después de eso pueden seguir usando el término siempre y cuando ya hayan explicado lo que significa esa abreviación. Y también les vamos a pedir que por favor hablen una persona a la vez, porque nosotros no queremos estar en la posición de priorizar una voz sobre la otra. Bien, entonces cualquier problema o dificultad que tengan con la interpretación, por favor háganos saber inmediatamente. Pueden escribirlo en el chat o simplemente digan algo para que les podamos ayudar. Entonces, eso será todo para el día de hoy y estas instrucciones. Les queremos agradecer a los organizadores de este evento por priorizar la justicia del lenguaje y crear este espacio multilingüe. Espero que lo disfruten. Muchísimas gracias.
Thank you so much, Gloria. I really appreciate this. Also, for those who may be hard of hearing, we do have a live closed captioning as well as ASL interpreters. So We Breathe is ensuring that this presentation has as much language justice as possible. So with that, let's go ahead and get started. I would like to introduce our panelists. If you don't mind introducing yourselves, I'll call on you one by one. Please state your name, pronouns, organizations, and how you are connected or working with the LGBTQ community. Dr. Ian Holloway, would you like to go first?
Thank you, Danny. Thank you so much for the invitation to be here. My name is Ian Holloway. I use he, him pronouns. I'm a professor of social welfare at UCLA in the Department of Social Welfare, which is located within the Luskin School of Public Affairs. And I'm also the principal investigator on a recently completed study. I'm trying to slow down now. Thank you. Which was entitled Tobacco Product and Cannabis Use Among Sexual and Gender Minority Emerging Adults. And that was funded by the Tobacco-Related Disease Research Program. I'm really happy to be with you and look forward to sharing some of the insights from our recent research.
Thank you so much. It's a pleasure to have you. Sandra, would you like to introduce yourself?
Yes, of course. Good morning, everybody. Thank you so much for having me here today. My name is Sandra Hernandez, she, her, hers pronouns. I'm the manager of operations at KK California, formerly known as the California Smokers Helpline. KK California is a text and talk-based support program that uses one-on-one coaching and proven science-based methods to help people who smoke, vape, or use smokeless tobacco quit. I'm really excited to be here today. KK California provides cessation services throughout the state of California. So we want to make sure to provide a space for the LGBTQ community for cessation support.
Thank you, Sandra. Tony, would you introduce yourself, please?
Hi, good morning, of course. Hi, everybody. Tony Viramontes, buenos dias. My pronouns are he, him. I'm the Director of Health and Prevention Programs at the LGBTQ Center in Orange County. Yes, we do have one. And I've been working here for 12 years now, so very involved in the health of the LGBTQ community of Orange County, and always with a health equity lens.
Thank you, Tony. Annabelle, if you can please introduce yourself.
Sure. Good morning, everybody. It's a pleasure to be here with you. Thank you for the invitation. My name is Annabelle Bolaños. I use she, her pronouns, and I'm with the Orange County Healthcare Agency Tobacco Use Prevention Program. And as the local lead agency for Orange County, it is our responsibility to provide services, tobacco prevention, education, and cessation throughout all of Orange County to all of the different populations. And we have partnered with the LGBTQ Center of Orange County through our coalition, our Tobacco and Vape Free OC Coalition, on different tobacco-related activities. And later on, we'll talk about one campaign that we did that was focused on the LGBTQ population so that we could promote our free cessation services. Thank you very much.
Thank you, Annabelle. And Jaina.
Hi, good morning, everyone. My name is Jaina Palasigi. I use she, her pronouns. I am the manager of 1866 New Lung, which is Orange County's free quit smoking, quit vaping services. So our services are free for adults and youth in Orange County. They can be accessed in person, virtually, or on the telephone. And they're available in English, Spanish, Vietnamese, Korean, and Farsi, and of course, the LGBTQ community.
Thank you so much. I really appreciate you all participating, and to kind of give a little bit of a background why we pulled this panel together and invited you all to participate is that We Breathe has been receiving a lot of technical assistance requests on how to navigate more conservative landscapes while trying to engage the LGBTQ community in tobacco control work. And instead of, myself and my colleagues, providing a bunch of different trainings and presentations, I thought it made more sense to bring in the other experts and colleagues that I work with who have done this work, who are doing this work, and can provide like real life examples of how you all navigated this. So before we actually jump into our conversation, if anyone has any questions, please put your questions in the question box and we will answer them at the end of the conversation. Ariella does have educational materials that our panelists so kindly sent to us, and Ariella will drop those materials in the chat box. But to start off, let's take a quick poll to see where folks feel they are at when it comes to working or collaborating with the LGBTQ community. How confident do folks feel? Are folks nervous working with LGBTQ folks and due to a political landscape in your region? Do you feel unsure? So if you don't mind just taking a few moments to complete this poll, we greatly appreciate it. We'll just give it a few moments. This way, it also helps us kind of gauge like what type of answers we should also be giving. Wow, thank you all so much for taking this poll. I'm seeing so many wonderful answers. Okay, we'll give it a few more moments. We still have a lot of answers coming in. And then for folks, if you're having a hard time downloading any of the educational materials, Ariella will also drop our email in the chat box where you can email us and we will send you the educational materials. Or if you would like to get in contact with any of our panelists, we would be more than happy to connect you to our panelists. It seems like the poll is kind of slowing down. Let's see here. All right, so it looks like we got some really great answers. We're gonna go ahead and close the poll so that way we can get started. Great, thank you so much. So just really quick, just to kind of share the results, it's pretty like kind of know or unsure on how to collaborate with the LGBTQ community, but over half really do feel confident to work with the community or they do currently collaborate, but how confident folks feel, kind of the same thing. There's some folks who feel very confident, as well as some like we're not sure or not confident. Luckily, a lot of people don't feel nervous working with our community due to the political landscape. So that's really amazing. Thank you so much. And then as for, did folks know that there's LGBTQ champions available for LGBTQ people at Kick It, California? A lot of folks didn't know. So Sandra, I'm just really glad you're here because we're going to talk about that today. Great. So let's go ahead and jump into the conversation. So really this first question is for Annabelle and Jana. As a local lead agency, you really do work with many different projects and priority populations. What is your greatest challenge when the LGBTQ projects came to fruition? And how did you navigate that challenge?
Thank you, Danny. I'm going to go ahead and start. So one of the challenges for us really has been to connect in a really meaningful way with the LGBTQ community in Orange County and to expand our network and strengthen our relationships with different organizations and individuals, different organizations that serve the LGBTQ population. So I'm going to touch on one way that we try to expand our promotion of our cessation line to spread awareness around the availability of free services to the LGBTQ population. I'm going to go ahead and share my screen because I think the visuals will help to bring the story to light. So let me go ahead and find my presentation here. Okay. And can everybody see that?
Yes.
Perfect. Okay. Okay. So as I had mentioned, our tobacco use prevention program is the local lead agency for Orange County. And as such, we wanted to create a media campaign that would effectively reach the community to let people know that we're here, we have this free service available. And so this is just a picture of our team. So I always highlight that it's really the people that are part of a program that make the program. And so it's a lot of very caring individuals that have a public health background in community outreach. And we really wanted to make that impact in our outreach. So as far as what we do work on eliminating those tobacco-related disparities. And we know that smoking rates are higher among the LGBTQ population. So we wanted to address that disparity by increasing that promotion of the services and get more individuals to sign up and get free support to quit, because we know how challenging it is to quit nicotine addiction. So it started with, we were able to work with a media firm. This was in 2019. And so we worked with the firm to come up with a media campaign to promote the line. And we thought, who are the groups in Orange County that we have not really reached effectively, that we have not focused on and we should be focusing on. And the LGBTQ population was definitely a population that we had not previously really done good outreach with. And so we wanted to change that. We wanted to change that around. And so what we did is, Danny, you probably recall, I reached out to you. I said, Danny, can you please help us? We're trying to figure out where we can do a focus group. We want to get feedback. As we know, in public health practice, it is essential that we test our materials with the community that we're trying to reach, because we can make a lot of wrong assumptions about what people will like, what will resonate with them. And so what we did is we actually pulled some existing artwork from the state. The animal pictures you see here are from an existing material from the Tobacco Education Clearinghouse of California. And so our media firm took some artwork that was existing. They put our 1866 new lung line on it. They changed the color in the back to make it like a rainbow color gradient. And we were going to test this out along with this artwork, which was also an existing state artwork that we borrowed. So thank God for our manager, who's now retired, Amy Buck, who said, before we move forward, let's do some ground truthing, because we don't know if these same messages and imagery are going to resonate with the community. So that's when I reached out to Danny, and Danny was wonderful. And he said, let's try to get you some time with a group at the LGBTQ Center in Orange County to do a focus group, to have some time on the agenda. So I want to share some of the feedback we got from the focus group, because I think this really points to the importance of making sure that our messaging, our materials, our strategies for reaching out to the LGBTQ population, it's so important to engage the community members, involve them in the process, and again, not make assumptions. And a focus group isn't asking my friend or my family member, what do you think about this, right? Because sometimes to expedite things, we want to do that, but no, we need to get a broad base of people that are representative of the population and really get honest feedback. So we did our focus group in March of 2019, and I want to give you some feedback that we got on the artwork with the animals, with the face masks on, or not face masks, but the gas masks on. So this is what people said. They said, well, these are comical, but I think it's about congested LA traffic air quality. I get that smoking kills cats. So I understand the fact that there's an animal, but I don't know how it affects health. I don't see the connection of the health effect here with the picture of a pet. My first instinct was to laugh and take a picture to send to my friend. It looks like a gas mask. It's more like about going outside. It's more associated with environmental pollution. Nothing in the image says cigarettes, so it is easy to go into air pollution. Okay, so then we tested the rainbow ad, and this is what the responses were. The responses were, this ad resonates stronger. I recognize immediately how tobacco companies target the LGBTQ community. This ad stands out more, and I recognized it right away. This text stands out more because of the Black background. This ad connects more and fits within the community. I feel sad that the cigarette is part of the flag because not every gay person smokes. Another person said they liked it because it shows how smoking is part of the LGBTQ community. The wording is clear regarding what the message is. The ad looks like something that would get my attention at a metro station. Okay, so given that feedback, which one do you think people chose? They chose the rainbow ad with the cigarette. They said that ad would reach the LGBTQ population more effectively. And having the cigarette be part of the flag explained what it is about without actually having to use words. One of the recommendations we did get is to change the slogan from why does smoking need to be part of us to what does not belong. Again, because people said, well, not every person who is LGBTQ smokes, so they didn't want to give that impression either. So they said the other two ads were more ambiguous. They thought having the color gradient in itself did not imply that the campaign was aimed at the LGBTQ community, and that the message also was not clear. So this was our final ad. What does not belong? Call 1-866 New Lung for free help to quit smoking or vaping. Now the ad was placed for a month in April of 2019 through these different media. So display ads where people, so some of these were digital ads. People could click to call the line directly or click to go to our website. There were audio ads, Google AdWords, email blasts, bus shelters, gas toppers, and print ads. The great thing about working with the media firm is they're able to identify how to best reach the LGBTQ population. So these were specifically geared to the LGBTQ population to ensure that there was a higher likelihood of people seeing the ads and then taking action. And so I want to show you this because I'm not a media person, I'm not a media expert, but for those of you who are, this will make sense to you. Just wanted to say that in terms of our engagement, we did have an average of 1.9% of click rate. Now I understand the industry average is like 2 to 5%, so we were right there around 2%. So we did have higher engagement with the full screen ads where it was 3.13. But all our banner sizes were able to serve high impressions and high engagements. All of which is to say that we don't have a comparison if we had used a different ad or different messaging, but certainly we know that because of the collaborative effort of partnering with the LGBTQ Center and talking with individuals that we wanted to reach, that we were more likely and did reach the population as we had intended. And so again, just to point out, to make those meaningful connections, and it wasn't just about, let's put the ad together and put it out there. We developed a relationship and rapport with these focus group participants, with the staff at the LGBTQ Center, with Tony, who is always wonderful. We've continued to collaborate with them on a whole bunch of things, on surveys and all kinds of educational activities. And so we're just really, that kind of initiated and kind of launched that working relationship with them. So we were so pleased to be able to provide this. And so that's our story. And I'm going to transition over to Jana. She'll have an opportunity now to share more about their outreach to different organizations in Orange County. But that's our story. So I appreciate you letting me talk about what happened with our campaign and the lessons that we learned from that.
Thank you, Annabelle. Again, my name is Jana Polisigi. I'm the manager with 1-866 New Lung. And if we could go to the introduction slide for 1-866 New Lung, what we do is we provide free quit smoking and free quit vaping services to youth and adults in Orange County. So after Annabelle had worked so diligently in making all those campaigns and ads placement for us, we wanted to make sure as the agency that gives a New Lung program, we wanted to be ready, especially for the LGBTQ community, to receive the free services that we have available. So we'll go to the next slide. What exactly do we do as New Lung? We have a variety of different ways that people can receive cessation counseling or cessation services. So as you can see, we had to make some adjustments during the pandemic because typically a lot of people who would join New Lung program would want to join a group class. And the reason for that is because they like the social support. They want to be able to share their successes and challenges in going through their quit journey with people who are experiencing the same things. But, during COVID-19, we obviously couldn't do the group classes. So what we did is we adjusted and we offered virtual cessation counseling as well as telephone. Now that we're kind of loosening up in restrictions, we are offering in-person individual counseling as well. And hopefully once everyone starts to be more comfortable, whenever that time frame is, we'll be able to offer group classes as well. So as you can see here, there are a variety of ways that we promote New Lung services, whether it's placement on a billboard. We also do outreaching at events where we table and give promotional materials and even some express counseling right at these health fairs. And then we work with different tobacco control agencies to do presentations such as the one that you see in the picture below. And we'll go to the next slide. But one of the things that we want to talk about is part of our discussion today is how do we navigate in a conservative environment. And, for many of us, we know that Orange County is typically a conservative environment. So we wanted to be sure as Nulung, how can we be more inclusive? How can we contribute to the data to show that we are serving the LGBTQ community? And how do we continuously improve our program and protocol so that some of this data could be meaningful? We're taking baby steps. As mentioned before, we are in Orange County, but we wanted to share with you in this portion how we included a question about gender. So we'll go to the next slide. And although we know that, gender is not all encompassing in regards to collecting data for people who are LGBTQ, it is a first step. We are taking that baby step to include this type of information and collect data that can be helpful in the broader research in this field. So I see how someone's asking about flyers, and we could answer that a little bit later in the chat. But as you can see, this question right here is number 16 in our intake form out of 18 questions, and it's asking, what is your sex or current gender? So just to take note that this question wasn't even on our intake form before 2015. So it's actually relatively new. Before 2015, we didn't even have this question on our intake form. So this, shows the progress and what we're trying to do in order to capture this data. And as you can see, the options are female, male, trans female, trans woman, trans male, trans man, genderqueer, additional category where they could specify, and decline to state. So moving over to the next slide, as I mentioned earlier in my introduction, Nulung services are in English, Spanish, Vietnamese, Korean, and Farsi. And the reason why our services are in those languages is because specifically in Orange County, those are the populations that have the highest smoking prevalence in Orange County. So we want to make sure that we're able to provide services in those languages because they have higher need. So as we're going through, these translations, it's just really interesting to kind of see the evolution and the difficulties and challenges even with this question. So what we did is we asked our bilingual specialists who provide the services in their respective language, how was their experience in translating this question onto their respective intake forms? So as you can see, there's a comment on the bottom in green that says all Spanish terms translate to the same corresponding English word. So in Spanish, we had the least difficulty in translating this question. As you can see are the equal ones right there. However, things get a little bit more challenging if you go to the next slide and we translate it into Vietnamese. So for those of you who may or may not know, Vietnamese tends to be a conservative culture. So we actually have two different revisions of that question in the intake form. Because as people who speak maybe different languages, there's not always an exact translation from one word to another, especially even just in the English languages, some of these gender terms are new as well. So as you can see, here is a quote from our Vietnamese tobacco cessation specialist, T. She says when she was translating this question, according to Vietnamese website, genderqueer is a very new term in the LGBT community, but I would say, and I apologize if I don't pronounce this correctly, da deng goi equals gender diversity, and in English that is genderqueer, because it is a spectrum of gender identities that are not strictly male or female, identities outside of gender dualism. The previous translation, so we had a previous translation of this intake form, meant a person who is attracted to the same sex, which I don't think is the most accurate translation. So as you can see, we're trying to always refine this information, even in as simple as something as one question in our intake form, not just our services for everyone, but we're always trying to make sure that we're being as inclusive as possible, revisiting the materials that we use to ensure that it is as comfortable for as many people as possible. And then if you go to the next slide, for some of you may know, Korean is also a pretty conservative culture. The Korean specialist, Gina, said, all Korean terms directly translate except for genderqueer. It just translates to genderqueer, so like the way that it sounds, that's how they translate it when they wrote it. But in Korean, accent spelling. Korea is still a very conservative country, so words like genderqueer do not exist. If a Korean person were to read that, they will most likely not know what it means, and I will have to explain it to them. However, that term is in the Korean LGBTQ dictionary. So it was really interesting to have this conversation because, in this process of us trying to be more inclusive with the data and to really see, are we reaching these different types of people? What we realize, and even just having the translations and just having this question 16 on our intake form, is it provides a learning opportunity, right? Especially in a conservative county like Orange County, just seeing that on something that you're filling out does like spark a light bulb, and you're like, what is that? And that gives us as New Lung an opportunity to open up that conversation to increase awareness about the LGBTQ community. And then to the next slide, we wanted to mention some of the outreach that we've been doing with LGBTQ facilities in Orange County. So as you can see, we have them listed here by city. In Irvine, we outreach to Radiant Health Centers, OC Equality Coalition, IBC Pride Scholars Program, that's a college, For Families, UCI, LGBTRC, and Orange. You could see all of those places, including the UCI Health Gender Diversity Program. Santa Ana has a great amount of facilities there, and even as far south as Laguna Hills, which is near where I live as well. So we'll go on to the next slide. And of course, as I mentioned, we need to improve. There's so much more work to be done, especially with providing access and just visibility of the New Lung services in Orange County. We're so lucky that we have funding just for Orange County residents. So we want to make sure take advantage as much as possible, because everyone who receives our services that are 18 years and above receive a free supply of nicotine patches. And so for some of you who have ever used nicotine patches before, they're not cheap. They're not cheap, and it's been shown to have higher efficacy in remaining a quit status when you combine counseling with nicotine patches. So we'd love if everyone could help us spread the word. 1-866 New Lung. We have a website, which is 1-866newlung.com. And also you'll be able, so as someone asked about flyers, to download our community toolkit. So in that toolkit has all our flyers in all languages that you can distribute electronically or print as much as you like to really help us get more people to enroll in the program and really benefit from the free service that we have in Orange County.
Great. Thank you so much, Annabelle and Jana. That was just a lot of amazing information, and I'm just really appreciative of all of the work that you're doing to learn and continue to learn to include our community in your work. Tony, just hearing about how the local lead agency and 888 New Lung is really adapting their services and their work around the LGBTQ community. What are some of the challenges and barriers your project is encountering when engaging our community to participate in cessation or even community education?
Hi, absolutely. Thank you, Danny, for that question. And again, Annabelle and Jana, thank you so much. I know that we've had this conversation and we've supported each other a lot through technical assistance and support. So I am very grateful for these partnerships that we've developed. I guess I'll start by saying that our program is fairly new in terms of like our cessation program and linking individuals and doing that kind of navigation, right? Also, I have to preface it by stating that we began doing this work in the middle of a pandemic. So I know that things look different right now, right? Some needs are incredibly heightened. So, sorry, I'll speak slower. But through the program that we've been doing for a little over a year now, and through our follow-up process, we've identified some very specific barriers, right, that are unique to our community and also unique to the clients we serve. Now, by no means is this meant to be a community-wide needs assessment, and I think that's definitely in the plans to better understand, right, how all of Orange County is the barriers they're experiencing. But when it comes to cessation services, through our program, one of through follow-ups, one of the biggest recommendations that we get from the individuals we serve is the need for an ongoing support, right, through cessation services, meaning that sometimes there's that initial conversation followed by a phone call, and then there's a 3 or 6 month follow-up, and then there's a yearly follow-up after that, right? But and those are crucial. They're very important points to follow up with the individual. But for the community, it's not enough, right? There needs to be more follow-up. There needs to be more, a bigger approach to be intentional and really reaching out. And I know that these are bigger conversations, we're talking about capacity at the agency level as well. But when we ask individuals, did you relapse? A lot of the time says yes. Well, why? It's because I didn't have the support from month 1 to month 3. We see that happen a lot. Another big recommendation that we've gotten from our clients is the patches. Patches are super beneficial, but there's and again, this has to do with capacity at the agency level. Sometimes the amount of patches they get is limited. They're provided with 2 weeks of patches, and then they are encouraged to navigate their own insurance or healthcare systems, right? To continue patches and cessation services through their medical provider. However, the LGBTQ community experiences a very unique set of disparities, right? One of them, a big one, is a barrier in accessing healthcare. I mean, just through some of my research, I've found that, and by no means am I speaking for the trans community here, I want to make that clear, but through some of the research I've found, I've found that more than 70% of trans people avoid seeing a medical provider because of anticipated discrimination, right? So when we add that layer, when someone is encouraged to take ownership of their own cessation by seeking help from their medical provider, but then that's layered with this anticipated fear of discrimination, well, that's a barrier. That's a huge barrier, right? That coupled with the fact that there's a lull in the time lapse of follow-ups, those all become just challenges and barriers for specifically for the community. And then another big thing that has come up, and again, as LGBTQ individuals, we are faced with a very unique set of stressors, right? And that's why some members of the community smoke and use tobacco products to cope with those stressors. I mean, the process of coming out is usually coupled or accompanied with discrimination and stigma and displacement, and in some cases homelessness, right? And that's just the beginning of a lot of other issues that the community experiences. So what we've seen, again, through the clients we've served through our cessation services program, is that there really is this need to provide programming that increases self-efficacy in managing stress, right? And finding and really addressing the behavior at the individual level and habits. Or any other kind of behaviors that will replace the tobacco product as that coping mechanism. That is something we see a big need of. So what I would say is definitely mental health support, therapists, but and then I have some recommendations for that. I'm sure we'll get to that later. But yeah, those are the barriers we're seeing. I'll summarize, but more ongoing support through the cessation process, more access to patches or free medical providers who are affirming and we know are affirming and are able to provide this service, right, at a low cost. Because another big disparity we encounter as LGBTQ people is low socioeconomic status, and that alone becomes a barrier for accessing healthcare. And then another big barrier that we're seeing, again, is how are we addressing the behaviors, right? How are we truly addressing those coping mechanisms? How are we truly addressing these habits, right? What holistic approach are we taking that truly address that at the interpersonal individual level?
Right. Oh, Tony, thank you so much. That's a lot of great information. And it just really makes me think about, Ian, and, your research project that you've been doing at UCLA. Tony talked about a lot of the challenges and barriers, discrimination, rejection. Can you talk about your research and, if your research aligns with what Tony has described?
Yeah, a lot of what Tony was saying really resonated. And what I'd like to do is tell folks a little bit about the study that we conducted, which I alluded to at the beginning of the webinar, and then give some insights about what additional analyses we plan to do, which I think will tap more directly into some of the issues Tony was talking about. So I'm trying to talk slowly. This is just such a fantastic model, Danny, for how to make a webinar accessible. And I'm certainly, learning from all of the panelists. So this is one of the resources that is available to you via the chat. And it's an infographic that our research team put together to highlight some of the top line findings about our recent tobacco-related disease research program funded study, which was titled Tobacco Use Among Sexual and Gender Minority Emerging Adults in California. So what do we mean by sexual and gender minority folks? Well, this could include, I apologize for the barking dogs, it's like Murphy's Law. Lesbian, gay, bisexual, transgender, queer questioning, asexual, intersex, and other sexual and gender minority individuals. And the emerging adult piece refers to this very important age span in the life course, the 18 to 29-year-old period. And the reason that we focused on these communities and this particular age period are twofold. One is that these communities have been included in research to date, but largely as a monolith. So not really allowing us to understand subgroup differences. And you can see the different gender identities and sexual orientations represented among the study sample, which in the end, when it came to the sexual and gender minority group overall, there were 850. Emerging adults, and they all responded to a confidential online survey. We were especially interested in this period of emerging adulthood because it's at that time when, as Tony, I think, really eloquently spoke about, the coming out process for many people is in full swing. Folks are individuating or gaining greater independence from their families of origin. It may be the first time that they're able to kind of integrate into LGBTQ plus community spaces. And so we had two main ideas driving this research. What were the mechanisms by which LGBTQ plus emerging adults engaged in tobacco product use? And one model, and one that's been written about a bit, is the stress coping model. Tony talked about that in terms of cessation and the importance in providing mental health support and stress management as a pathway to cessation. The other is a model of social norms and affiliation. And we know that because there is higher incidence of smoking among LGBTQ plus communities compared to their heterosexual cisgender counterparts, that social norms around tobacco product use tend to be more accepting. And so we wanted to see, what mechanisms were operating for diverse subgroups. And so that's some of the information I'll look forward to sharing with you, because I think that can be really instrumental in providing culturally tailored cessation programs for diverse subgroups of LGBTQ plus people. But just to highlight some of the main findings that some of you may want to take back to your agencies, and please do share this infographic. If you need physical copies, we can get those printed and mailed out to you. And we're also happy to speak to community partners. So I think our contact information will be available to everyone on the webinar. Our key partners for this work were We Breathe, and Out Against Big Tobacco, two community coalitions who really helped us with the framing of this work, recruitment, thinking through now results dissemination and interpretation, and also the Los Angeles LGBT Center. And so what we found when we're looking at current tobacco use among folks who use tobacco products and have used them in the past 30 days is that newer delivery mechanisms like e-nicotine devices are highly popular. That likely is not a surprise to those of you on this call. But I do think it's useful for us to think about cessation efforts by tobacco product subtype, because there may be different dynamics in terms of where and when people use e-nicotine devices compared to combustible products like manufactured cigarettes, which over half of respondents used, smaller percentages of hand-rolled cigarettes and cigars. We also saw just under cigars was hookah or water pipe use, which may be particularly popular among subsets of LGBTQ plus folks. So when we look at, were there differences between sexual minority women versus sexual minority men versus gender diverse people, and you can see how we define those terms on the infographic here. You can see my cursor. Is we really see high use of e-nicotine device among sexual minority women, high use of manufactured cigarette among cisgender sexual minority women, as well as gender diverse people. When it comes to hand-rolled cigarettes, those two groups are also using those two product types, and cigars as well. So I think that some of these data really speak to the need for those subgroup specific interventions. When we asked participants what their plans were for quitting tobacco product use for good, I think hearteningly, cisgender sexual minority women, lesbian, bisexual, other sexual minority women were the group that seemed to have the largest percentage of willingness to think about quitting for good. And that corresponds with use. Less certainty about that prospect among cisgender sexual minority men and gender diverse people. The other piece of data that I'd like to share, so kind of the main take home from our research is that culturally tailored interventions that are specifically designed for subgroups of LGBTQ plus people are needed. And we see there's limited evidence for that, although folks on this webinar are doing amazing work in community settings, which is hopeful. When we asked participants who were thinking about quitting all tobacco products for good, what tools and resources they thought would be most helpful to them in future quit attempts, over half said incentives. This is something that we don't often think about in traditional public health models, but contingency management or offering people payment to quit substance use, including tobacco use, has been highly effective in other communities. And so I think that's an avenue for us to explore as folks who are interested in tobacco product cessation among sexual and gender minority people. Tony mentioned the economic hardship that young LGBTQ plus people can face, alienation from families, and stress related to stigma and discrimination. And so financial incentives are a really concrete way to kind of help on two fronts. The other popular tools and resources endorsed by participants who were thinking of quitting included, and these are all at about the 30 to 35% range of participants who endorse these: mental health resources, low-cost nicotine gum patches, and other tools for cessation, smartphone app delivered interventions, so interventions that can be delivered quickly and conveniently to people where they are, and then individual therapy. So I think what these data kind of point to is the need for holistic interventions, culturally tailored, obviously, and maybe subgroup specific, but also kind of recognizing that LGBTQ plus folks might need a range of different supports as they're quitting. One of the things Danny asked me to highlight in some of the preliminary work that we did for this webinar is any findings from our qualitative data that might be particularly informative for this group. And so I did want to speak to a phenomenon that we observed. In advance of doing this online quantitative survey, we talked to 40 sexual gender minority people from those diverse subgroups that I mentioned about some of the challenges related to quitting. And what came up consistently was the fact that smoking cessation wasn't necessarily at the top of the priority list for these folks who were struggling with so many other hardships, economic, related to stigma and discrimination, concrete needs like housing. And so I do think we need to tackle smoking cessation among LGBTQ plus people, especially emerging adults, from social determinants of health perspective. The other phenomenon that we observed, which wasn't endorsed by as many participants as those who were struggling with other more kind of immediate needs, was an idea that their lives were disposable in a way, that they didn't feel kind of the sense of self-efficacy in order to remain healthy. And why did it matter if they smoked? The theme that we used to identify these folks was related to intentional self-harm. So thinking about smoking as something that they knew was harmful for their health, that they really, didn't have immediate plans to quit because it was, a way to demonstrate their own kind of disregard for their health and well-being. So kind of this like volitional way of hurting themselves. And I think that, finding for us was really striking and poignant because it speaks to the realities of many LGBTQ plus smokers. There are larger mental health issues going on that are largely driven by coming of age in this participant population in a society that still is discriminatory and heavily stigmatizing toward LGBTQ plus identities. So I think we have good work to do on the individual level. We hope that some of our data can inform that, but we also have major structural change to try and enact, and that's a little bit harder. But I'm so grateful to the folks at We Breathe and Out Against Big Tobacco who are trying to advance this agenda. When it comes to the urgency of this, smoking kills more LGBTQ plus people than many of the things we hear about more often, like methamphetamine or chemsex is something that gets a lot of attention in queer communities. Tobacco product use accounts for more mortality, and yet doesn't get the same kind of traction when it comes to public health messaging. So I think that this work is really important, and I'll stop there, Danny, but happy to answer questions toward the end.
No, thank you, Ian. That's just like so much amazing information. And I've had the privilege to work with you, for the last 3.5 years, and just to see like how all of this can inform our work, and, really when you were talking about like culturally tailored cessation, I was really excited when Sandra stated that she was happy to hop on this webinar as well, because Kick It California has LGBTQ champions. And Sandra, I'm really hoping that you can kind of talk a little about like, what are the LGBTQ champions? What is their purpose? And how are they engaged with the other LGBTQ projects across the state?
Yeah, thank you for that question, Danny. I think, thinking back at the start of our LGBTQ champions, it was in collaboration with We Breathe and some meetings with you and with Amanda that Kick It California really saw a need to identify some LGBTQ champions within the organization. They do identify as LGBTQ, and their main role is to keep the conversation going on how to provide services to the population. They attend extra trainings, webinars around tobacco use and cessation and the impact on the LGBTQ community. So some of them might be on this webinar today, actually listening in. So in addition to our LGBTQ champions, and although all of our coaches go through cultural competency training for specific populations in addition to LGBTQ, so they're really all prepared to work with a diverse population, we reached out to our coaching staff and identified LGBTQ allies as well. So these are coaches who have stepped forward and specifically expressed interest in working with LGBTQ callers. And we do this with a variety of populations. For example, we might even have someone that calls in and says, hey, I really only want to talk to someone who used to smoke. I don't want to talk to someone who was never a smoker. So we have people that are specifically there to help people that want to speak with someone who smoked before. So we're kind of adapting that same format for LGBTQ. And if we see that need, we're able to go ahead and meet that need for that caller at that time.
Wow, that's great. Thank you so much. I really appreciate all that Kick It California is doing. I've also learned that Kick It California can now provide data on caller demographics, including broken down by SOGI data, race, ethnicity. Can you talk a little bit about that?
Yeah, of course. So data is the big thing, right? Everybody wants it, needs it. And there's a lot of it that we have at Kick It California. So let me start with what's available at kickitca.org at this time. So we recently went through a whole rebrand. We were formerly known as the California Smokers Helpline. So not only was the rebranding taking a lot of our resources, but the creation of the new website as well. So we haven't quite gotten to the reporting piece yet. So what's on there now is what's been there for a while. We provide 6-month reports that show the breakdown of callers in the entire state of California and also by county. So if you're only interested in a specific county, you can find that, or you can look at the entire state. This does include, as you mentioned, Danny, SOGI data, as well as age, ethnicity, language, and more. The report, however, doesn't break down LGBTQ specific data down further at this time. I'd also like to note they're not the most user-friendly reports right now, so always reach out if you have any questions on how to read the reports. But now that the big lifting for the rebrand and the new website is complete, we're starting up those discussions around data and reporting needs. So really, I think tapping into anybody that's on this webinar and my fellow panelists, any thoughts on what the needs are, what kind of data needs to be put out there, please feel free to reach out to me directly, and we'd be interested in hearing any thoughts around that as well as we dive back into those discussions.
Thank you so much. I really do appreciate all the work Kick It California is doing, especially you, Sandra. I mean, you've just been doing so much for our community. And really, as the LGBTQ statewide coordinating center, I've really had the privilege to work and collaborate with all of you to address health equity issues within the LGBTQ community and tobacco control. And as we all can see here, we all come from various projects and backgrounds, local lead agencies, researchers, technical assistant providers, regional projects. But I think what this webinar is really showing is how much we need each other, and we need each other to finish the fight to end tobacco usage in California by 2035. And collaboration really is a powerful tool. I mean, just look at how our work has been layered on top of each other because of what we're all working on together. So could you all share with our participants how this collaboration has benefited your work and why people should think outside the box and work with different funded projects and non-traditional partners we never would have thought to work with?
I can start us off, Danny, because I believe so strongly in this type of academic community partnership that we've been able to build over the past 3 years around this topic. So one of the goals of the center that I direct at UCLA, which is called the Hub for Health Intervention Policy and Practice, kind of our primary vision is that communities hold the power to shape their health and well-being. And so as academics, we have often kind of remained in the university silo and haven't collaborated across sectors. And I think to the detriment of all of us. So I'm, from the academic side, so thrilled to have such great partners who are doing work in communities, because I think it enables us to structure research that can be implemented in a way that's going to have maximum impact for the communities that we all hope to serve. So one of the most powerful things about this collaboration for me has been learning from all of you, the folks who are on the front lines, trying to fight for health equity for LGBTQ plus people, and for us to kind of get out of the way and kind of let you lead in terms of formulating questions, deciding how projects should be implemented, and what kind of data can be most useful. So I would encourage anyone on the phone, on the webinar who's listening from an academic institution to really think about getting out of the university silo and forging these collaborations, because I think they enrich our work, but ultimately they ensure that it will have the maximum public impact.
I can jump in, Danny. So I do think it's really important. One of our, like I said, as a local agency, one of our responsibilities is to make sure that we are addressing health-related disparities due to tobacco and vape use in our communities. And, reality is that there is limited funding, right? So it is very important that we allocate funding appropriately to the communities that are being hardest hit by tobacco marketing. In fact, we've incorporated themes and discussions around tobacco marketing in our youth vaping prevention educational presentations, where we talk about how the tobacco industry does target LGBTQ population and Latinos and African Americans and low socioeconomic status communities, because we want to plant that seed for young people so they can start thinking about the ways that the tobacco industry does impact whether it's their local community or their friends or their neighbors, and so kind of broaden that understanding and expand that knowledge base. And so for us, we want to continue to improve, understand better what we need to do to bridge that gap that exists and make sure that our prevention and our cessation resources are reaching the people who need them the most. So I think being able to collaborate with you and with the other partners here today and having people be able to learn more about what the needs are helps us to do a better job and to be to really maximize, as Ian was saying, to really maximize the resources that we have and funding that we have available, and do our best with that, so we can end the tobacco epidemic by 2035. So thank you.
I'll jump in. I'll be brief. I think those are such wonderful things, but I mean, it truly takes a village, and I think having these conversations is really important. We support each other, we lean on each other. That's how we collaborate. I've collaborated with everyone here. I mean, Sandra, you came in and did this wonderful training for my staff, and I'm about to call you later to do another one because I need it and my staff needs it, and it's really important, right, to have a systems level approach to the work we do, where we involve each other, where we support each other. I think one missing factor of the collaborative effort is collaborating with community, truly understanding. And I know that we've been doing this through focus groups and through consumer testing, but really inviting community to be a part of this conversation, right? Because we want to be intentional in our approach to addressing the issues, to addressing the environmental factors, right, that lead to the use of tobacco products, to truly addressing the determinants to health. And that's where we all come in together. Our expertise is valued and stronger when we are pushing for this together.
Great, thank you so much. We have about 20 minutes left, so I want to make sure that we go through some of the Q&A. And one of our questions is actually from Canada. The question is, we are just about to launch a program in Canada, Toronto, Montreal, and Thunder Bay, specific to LGBTQ youth. It will over time include trial NRT packs, contests, and quit coaching. We struggled with our marketing as we found it difficult to address communities separately. We co-created our youth advisory groups, and it will speak to their larger group. How would you suggest that we consider identifying ways to take it from a mass marketing strategy to a more specific community or identity level? That's a deep question. So Tony, I know you work a lot with youth, and I see your face like, oh no, you called on me. But
Panic.
I know, right? But you do work a lot with, you have a youth advisory group and everything, and you're really trying to reach that messaging to, prevent tobacco usage, to curb tobacco usage. So how can folks identify, like, how do you take it from this big media marketing strategy to community level, like even breaking it down by gender identity or sexual orientation?
There's really a lot to unpack here. I mean, if we're taking the community approach, I'm only speaking from my experience, right? And my experience, which is very unique to Orange County, but we've taken a grassroots approach to really working with communities. So the partnerships, again, the collaboration, right? We work with GSAs, we work with other youth serving agencies. We're very intentional in inviting youth to the table who have something to say, and all youth have something to say. We're very intentional in creating a safe space and allowing individuals to be the individual first, right? It's really important to, because we're all human and we all come from a place of not all, but some of us come from a place of trauma, and it's about this destigmatizing that, right? It's about even destigmatizing mental health, and mental health issues that are so unique to the LGBTQ community that we've normalized, right? A lot of us will think, oh, well, it's okay, everyone has depression, it's normalized, it's okay, everyone has some kind of body dysmorphia, that's okay. Everyone has self-harm thoughts, right? And through a community, a lot of those thought processes have been normalized. So it's about really being intentional in having those conversations, destigmatizing those conversations, specifically with youth, when creating a safe space, when truly engaging and involving them in shaping the framework of the work we are doing. I don't know if that answers the question. There's a lot here to answer.
It is. But I mean, I feel like you gave like some really good examples and everything. And just to let folks know, we did drop all of the panelists' email addresses in the chat. So that way, if you want to reach out personally, you are able to do so. This next question is, and this was actually asked during Ian's discussion. Do you have data for LGBTQ youth? And they would love to see the data for sexual gender minority youth and tobacco use. And if no, and I think this is a question for like Jaina and Sandra, are these cessation resources available to the youth, or is it geared towards adults? And would the apps be okay for the youth to use?
Well, I can tackle the first part. So our data is now publicly available. We're really interested in partnering with community-based organizations and others throughout the state of California who are working on these issues and possibly beyond. So our data captures one life stage, which I think can be broadly defined as youth, that kind of emerging adulthood life stage. But I'm not aware of data other than kind of broad surveillance data, like perhaps from the California Health Interview Survey that looks at individuals younger than 18. And we know for many LGBTQ plus adolescents, smoking starts younger than 18. So I think our data can be useful for a particular set of youth, but we should be advocating for more and better data collection among younger LGBTQ plus people. So if the person who posted that question wants to reach out to me directly, I can point you towards some leads, and certainly we can have conversations about what insights you might be able to glean from our data.
I can jump in here in terms of services offered through Kick It California, which we've got our telephone coaching, we've got the texting service, we've got a mobile app, an Amazon Alexa skill. All of those are really available for anybody 13 years and above. So yeah, they should be good to go 13 and above. Anybody under 13, really what we're limited to is providing self-help materials through either digital or physical form.
And then on behalf of 1866 New Lung, we do have our services for the youth as well. As some of you may expect, as much as we have tobacco and vape cessation services for the youth, the majority of our clients are for vape cessation. The way that we partner in order to get clients that are under the age of 18 is that we work with school districts in Orange County to provide these services. This way, it's a little bit easier for parents to drive to a location that they're familiar with, and they can wait in a different area while their youth is having cessation services and then pick them up at an appropriate time. It is very rare that a youth actually calls our hotline and wants cessation services for themselves, but that is still available to them. And what happens is they usually meet us in person at Anaheim Regional Medical Center, where our department is hosted, and we have private counseling rooms that we can provide services to with them. So everything taught is confidential while their parent waits in another part of the hospital. Typically, most of our youth clients are high school. We do get a few middle school. We don't necessarily have an age limit when it comes to working with school districts, but in my 9 years of being with New Lung, the youngest client we've had was 9 years old. So we do have specialized youth specific tailored curriculum for under 18 years old.
Wow, thank you so much. This next question is in regards to data collection. Are First Nation and Asian American Pacific Islander communities reflected in research and surveys?
It's a great question. In our study, we had a very small number of the racial ethnic groups described in the question. But I know the California Health Interview Survey, which I mentioned, and does include a tobacco module and actually has an LGBT specific module that's currently in the field or is just wrapped up, does some targeted outreach to racial ethnic groups that may not be broadly represented when we do the kind of population-based surveys. So they do something called oversampling, where they get more individuals of those identities in order to answer key questions. So I would just say, I'm happy to help folks investigate further. There are a handful of researchers that I know of across the country who are specifically doing work with Native American and Alaskan Indian populations, other Native communities around smoking cessation. and there's some really interesting kind of cultural dynamics around the use of tobacco as in ritual. So I can also provide linkages to some of those folks who may have a kind of a better understanding of some of the dynamics in the communities mentioned.
And can I add, I don't know if people are familiar also with the California Healthy Kids surveys. That's another data source. I know that they do ask and administer it at the schools, middle school, high school, and they do ask tobacco related questions, and they do break it down by ethnicity, race. I'm not sure though, and maybe somebody else is more familiar with this, if they ask around, if they are gender inclusive with the questions that they ask. I'm not familiar with that part of it. So anyway, California Healthy Kids Survey is another data source for people if you're not aware of that. And if you need more information about that survey, please feel free to email me and I can try to help out.
You know, that actually is, I was going to mention, it's a great survey. I use it a lot when I do my own research because it is pretty inclusive. It addresses what bullying looks like and rates of reporting bullying within LGBTQ and transgender youth. That survey specifically, and I'm citing the 2015 survey, so it's a little outdated, but that survey specifically states that 19% of LGBT youth in high school settings use some type of tobacco product, and that's obviously self-reported, which is 2 times higher than non-LGBT students. And then in terms of transgender students, the report states that tobacco use is 3 times higher.
Very true. Thank you so much. So some of these questions I want to read out now were answered in the Q&A box, but I still want to read them out, especially so we can continue to respect language justice. So if folks don't mind re-answering these questions verbally. So this question was for Annabelle. Who is the media agency you worked with?
Yes, we work with Brown Marketing Strategies. They are based in San Diego. And so if you'd like their contact information, I'm happy to share that with you. You can send me an email and connect you with them if you'd like to find out more.
Great, thank you. The next question is, if OC residents contact Kick It California, do they get rerouted to New Lung and receive the free NRT, or do they need to contact New Lung instead? They ask because they work with health systems statewide, and they also promote electronic referrals to Kick It California. And is there an electronic referral to New Lung?
I'll jump in on the first part. So thank you for setting up the electronic referrals to Kick It California. In terms of getting free patches from New Lung, they would need to contact New Lung directly, but we do periodically remind our coaches that OC has that extra little patches giveaway that we can refer out to them when appropriate. Kick It California does have some patch giveaways, but they're limited. So we try to promote out to whatever other programs might be providing them. In this case, we would send them to New Lung if necessary.
And then for the second half of that question, yes, 1866 New Lung does have an electronic referral program. I put it in the chat. You would just go to our website and there's a contact page. And then there you put in your information, and then a tobacco cessation specialist will reach out to that person to set up a counseling. Anyone can refer or call directly with our hotline, which is 1866 New Lung. And that way you'll be able to speak to a specialist to schedule the services for you to receive the nicotine patches. And we give a free 1-week supply of nicotine patches to all our participants who are 18 years and older.
Thank you so much. We did have someone ask, what is the term cisgender? Because it was on Ian's infographic. And for folks who might not know, cisgender is someone who aligns with their sex assigned at birth. Because I did not align with my sex assigned at birth, I transitioned. So I'm transgender. So I am not cisgender because I transitioned and I did not align with my body. The next question was asking, what is SOGI data, SOGI data? And SOGI data stands for sexual orientation and gender identity. This next question is for Sandra. Where can our community organizations find Kick It California marketing to share with the community serve that specifically mentions the LGBTQ services?
So unfortunately, we don't have anything promoting our LGBTQ services specifically, but I will link our brand toolkit in the chat box that has promotional downloads and flyers that can be used for promoting services for Kick It California.
Great, thank you so much. I'm looking through, oh wait, I think we got one more question. For all presenters, what has been an unexpected but valuable realization that you've learned while working on tobacco cessation in the LGBTQ plus community?
I'll take a stab at this. You know, one of the first, so even us, who we are at the LGBTQ Center, we work with LGBTQ community. A really the stark realization that I had in the beginning of the project was when we were creating the curriculum, creating the program, creating the materials, right? We were going off of our lens and our experience. And then when we consumer tested our own materials, there was a lot of, some of our stuff were rejected, right? Because we were taking the approach that we thought appropriate, and which is why I go back, it's imperative to include community in the collaboration, right? Because we had designed, again, curriculum and marketing materials based on what we thought would resonate. And we learned that we were way off.
Anyone else would like to share what they might have unexpected or had a valuable realization while working in tobacco cessation with our community? It's a pretty deep question.
It is a deep question. And I think what I continue to come back to, and maybe I realized this in a more abstract way before we did some of our qualitative work, is just how important it is to think about the structural and social determinants of health and the way that they impact LGBTQ plus people. I mean, many of us think about California as a very, progressive place, a place where, there are progressive policies supporting LGBTQ plus residents. And still the stigma and the everyday discrimination that many LGBTQ plus people face is overwhelming. And so tobacco can provide some sort of temporary relief from those very difficult circumstances. So I think it's been a good reminder for someone like me who's kind of trained in public health and thinking about individual level interventions to really zoom out and say we have a lot of work to do on structural issues as we continue to provide resources to help people quit using tobacco products.
I also kind of wanted to piggyback off of that. We talked about identifying, as a sex gender minority, but what I realized in being in cessation is that there's a compounding effect in identifying with multiple minorities. So for example, we had a youth client who was Vietnamese and also gay. So I don't think in the entire 60 minutes, we spent more than 10 minutes actually talking about tobacco cessation and quit strategies. It was more so like a counseling session, having him vent, helping him understand his landscape and trying to just talk about how he doesn't feel understood even by his family. His dad especially is doesn't understand the concept of being gay. And then him just trying to quit tobacco on top of that because his dad had lung cancer. You know what I mean? So there's so much pressure and it's just compounding effect in them trying to deal with so many things that tobacco cessation, I feel at an individual level for this community needs to be longer. It needs to be, as we discuss, more holistic, include a lot more like processes and procedures, but also counseling in many different aspects and depths in order to appropriately, help these people with what they need. So for me, that was really surprising because, like I said, that counseling session was maybe about like 90 minutes and only 10 minutes was talking about tobacco. So that was interesting to me.
Wow, thank you, Jana. That's very powerful, and everyone's just absolutely correct. And yes, intersectional identities and acknowledging them is very, very important in our work. I know that I would like to go longer, but we're at time. So I really want to thank our panelists for joining us today and for this wonderful collaboration. I also want to thank our ASL interpreters and Spanish interpreters for their time and energy to provide language justice. Once you close out the webinar, there will be an evaluation. I ask that you please complete it, and a reminder will be sent in your email tomorrow. But other than we really do thank everyone for joining us, and we hope you have a wonderful Thursday afternoon.